Hi, everyone. My name is Lotus Yu. I'm a senior manager of engagement and partnerships here at the Full Frame Initiative. And I'm excited today to share some on the ground stories about centering community. I'm joined by Angie Cochran, who's the Ohio START Caseworker in Trumbull County, Ohio, and Mike Kenney with the Public Children's Services Association of Ohio, who are doing incredible work centering community and co creating a framework that is led by those most impacted. They're here to tell us about that process and what it took to get here. Angie, could you start us off with why this work is important to you?
So yes, Lotus, this work is something that is not just purposeful to me, but it really hits home because I have that lived experience. I was a parent working with child welfare. My children were placed in foster care previously, and I had to work hand in hand, with Child Protective Services in order to reunify with my family. Um, now I'm a caseworker. I get to work with the families. I get to dedicate, my work, my time, and my efforts, and, achieving, for families what I got to achieve for myself. And it definitely makes it more purposeful and impactful for me to do this kind of work.
Thank you so much for sharing that. Yes, there definitely is something special that one can bring to the system when one has experienced it firsthand and is most impacted by what's happening there. So, what does it mean to, I guess, both of you, to have a shift towards centering community? Because it's not always the traditional way that systems operate.
Yeah, I mean, historically, our field of child welfare has relied on family separation as a method for achieving safety. And so, to be frank, our history is not one of centering on communities. The voices of professionals, of judges, of providers have always outweighed the perspectives of what families need. And so, in this effort, in this journey that we've been on for 2.5 years now together, centering community really means honoring families' expertise, honoring their culture, honoring their experiences. It means building trust through transparent decision making. It means meeting their true needs versus giving them what we have. And then, finally, I think centering around communities means believing that families can heal and change and grow.
Yeah, I agree with everything Mike had said. When you first initially asked the question, my first thought was, I'm the author of my own story. I get to write the narrative. And utilizing that lived experience to say that, I didn't have child welfare step into my life and write the narrative for me. I knew what I needed. I knew the kind of work that was ahead of me, but I also needed the guidance and support and services, of Child Protective Services and whatever they could refer me to in order to help me get there. I really feel that the work that we do is centered around the families and their needs. Not so much our policies and mandates, even though, we have to balance that out in our work. But if we want to make a difference, we really need to center our approach around the family's needs and let them be the authors of their stories.
Yeah, that's all very aligned with the way that we talk about well-being here at FFI. Just that if people know for themselves how they're meeting their needs for well-being, they're the ones that know like what are the costs of having to follow certain rules or policies, like what are the trade-offs that they're experiencing. And so what you're saying is very connected with this important shift. Um, You were saying that it took about 2.5 years, this process. Curious to hear about what that experience was like. Were there challenges that you faced? What were the lessons that you got from making that shift?
Gosh, so many good lessons learned. But Angie, I'm wondering, can you talk about what it was like when you first joined the group and coming into a room where there were directors and workers and folks from across the country that were unfamiliar to you?
Absolutely. It was intimidating. At that point in time, my role within Child Protective Services in the Ohio START program was as a peer supporter. So, I was really viewed as like the lower man on the totem pole. And here I'm coming in, into a room of individuals, who were much higher up than me. And, I found myself asking the question, like, why am I here? And what can I bring to the table? And the reality is that lived experience, not just as, a parent who had experienced, services from child welfare, but also as at the time a peer supporter and then eventually a caseworker. The many hats and the different perspectives definitely brought a lot to the table, and we needed that, as well as the naysayers. We needed to be challenged in our ideas and our vision, because we do, as child welfare, have to weigh out the balances of those policies and mandates, that really have driven our work over the decades. But now it's like, PACT came about to really change the way we do our work and what drives our work so that we can center our work on communities, so that we can focus on the families and their needs and partner with them and encourage them to, live better lives, have better outcomes.
Yeah, I love that. And I think, so many good points in there, but I think because we had the luxury of time, we got to really be intentional about creating a diverse group of voices, and nurturing psychological safety, really designing how we shared power, because there was inherent power differential in titles, as Angie mentioned, but also in experience. And, typically we defer to those in power, and creating and learning how to learn together to co-design took, and it wasn't linear. So for those watching from a lessons learned standpoint, there were times where, culture changes when you add or subtract anyone from the group. And so as we added and grew momentum, Angie, I'm reminded of times where we had new folks come in and we almost had to slow down, go back and nurture their own belief in this journey that we've been going on together. And so, to the root of your question about centering around those who've been or will be most impacted by this model, it's also pretty rare to have frontline workers designing solutions for how they deliver services. And we were intentional about this has to work in a major metro, right? An urban environment with 700 employees. And this has to work in a rural community with 6 employees or frontline staff. And so, there was one individual worker who regularly would just raise her hand and say, yeah, we can't do that in rural communities. And what does this mean if we say we want to walk the equity walk? Then how do we make this equitable for small communities that don't have the same level of resources? So I guess the short answer to your question is a lot of focus on power sharing, a lot of focus on building the confidence of those who previously weren't invited into spaces. And also, you refer to them, Angie, as naysayers. I think when folks historically have been marginalized and ignored, we can't count on the first few things out of their mouth to necessarily be within context. So giving people the space to grow into their voice was another key lesson learned.
I'd love to hear a little bit more about that. Mike, you talked about the differentials between the various titles, and Angie, hearing about your experience walking into that room for the first time and wondering what made it more possible. Like what is it? Because you can go into a room and say, yes, let's power share, let's power share, let's power share, but then to actually have real power sharing take place isn't just repeating it. So curious to hear from you all about like what made that possible for people to share power, for there to be the space for people to um, speak up and be involved in a full way.
Yeah, what a wonderful question to reflect on. Angie, are there things that come to mind? I mean, there's a couple of things that I go to, but what is it that shifted? Because I remember early on the word compliant or capable no, what was it? Competent. Competent was a word that we kept hearing
Mm.
from folks, that they wanted this model to just create competent people. And competent is like a moment in time that somehow you didn't know how to do it and now you know how to do it. And this work requires an environment of constant learning. So, Angie, do you remember how we shifted sort of from that compliance and competence into more of that hope and belief and values driven work? Were there moments for you?
I think for me, a big shift was, recognizing and understanding that every perspective at the table contributed something important to our vision. Because we're not just talking about centering communities, we were also talking about, values and practice and beliefs that really drive our work. So, it was like we needed so many different dynamics and perspectives brought to the table. And because we needed that diverse population brought to the table, we valued exactly what was brought so that we could work on this and really, find a purpose and vision and ideally create pact in our work, on that safe space, just understanding, like, I remember there were moments that we'd have conversations and it didn't matter who was speaking. We gave them the safe space that they needed to be open, honest, and share, and they were heard. And that really made all of us feel safe in the process and valued.
Mhm.
Yeah,
What were
really
the
great.
signals that you got that showed that the space was safe to you to be able to share and be heard?
I want to hear Angie's reaction to that, but I just want to bridge it by with a quick answer to the previous question. It wasn't one thing, it was 1,000 things.
Mm.
And then it was another, and then it's going to be another 1,000 after that, right? People needed to safety, psych safety, and even relational safety is built through predictable, repeatable experiences. And so I think we tried to create that space where we were listening, but also where we were purpose driven. Okay, I'll stop now. Angie, what did you think? How did you feel it?
So I felt it when I realized that everybody in the room was there for the same purpose.
Mm.
When I understood and felt that everybody in the room had this vision and we all wanted to bring it to life, and we were all trying to figure out how to do it together. So that's really when I started to feel safe, and really started to be able to say, okay, like I am part of this. We're all driving, the same car, we're all driving in the same direction. So that's really when things had changed for me.
That's awesome and very powerful. A very powerful piece. Thank you for sharing. Could you talk a little bit about how your work um, supports community well-being out in the community?
Yeah, in so many ways. Um, so acknowledging the inherent strengths and abilities within families and within communities. Angie, it reminds me, remember when we had so many of our values and statements written out as parents, caregivers, children, and youth? And I think it was a couple of folks also with lived experience, young adults who were in the care, in foster care earlier in their lives, who said, why don't we just call them families? And so to your question, Lotus, we use the term family in our field, but what we really mean is community. Because family is blood and non-blood. Family is the fictive aunt down the street that watches the kids while mom is at work or dad's at work, right? And so building networks of strength, like, and we often refer to them as forever and free, because so much of our system relies on paid supports. And so centering on community means building forever and free relationships, or free and forever relationships. Um, but I think the other way it supports community is keeping kids connected to their culture is so central to continuing their birthright of who am I, where did I come from, and where am I going, and maintaining their connection to kin, community, and culture is central to this work that we're doing.
I think for me, when I initially thought about that question, Lotus, I can kind of relate to like, okay, so I am part of a community, and every family that I work with is part of a community. And the work that I do with these families, to ensure their success, that they, are able to keep their children safe and have healthier, happier outcomes for their kids, as well as, the parents and any, of their community or familial supports, has a positive impact on the community. You know,
Mhm.
um, so if I take myself, for example, I was a family involved with the child welfare system. Now I'm a caseworker. Now I get to be, an advocate for other families, but also be part of programs like PACT, where we are making a difference, not just on an individual level, but a community level. It's so much more bigger than the families that we're working with, because they are part of the community and they all have a part to play to contribute to our communities. So what we do, whether it's the parent or their children, eventually they're going to be a part of their community and have a part to play. So we need to be there in order to help them be successful, have healthier, happier outcomes, and provide them with whatever services that are necessary in order to help them get there.
Mhm. I love this mental model that both of you are bringing to this, where it's all interconnected, that what's happening with the family is happening in the community, and that they're all in relationship, and also that family is this whole broad definition, allowing people to define for themselves who is family, and that whole interconnectedness there as well. What is one piece of advice you can give people or would give people on a journey towards centering community?
I feel like I'm always going first. Angie, do you want to go first?
I feel like you're always throwing me out there to go first. A piece of advice. I'm gonna have to think on that for a minute. Mike, you're
I'll
gonna
jump.
have to go
Yeah,
first.
yeah, I'll jump in. Um, my advice, if you're really truly committed to centering around community, is to be prepared and to own that it is messier, it is complicated, and it is infinitely more effective. So
Mm.
you'll get there, trust the process, but don't expect it to be easy. Generational trauma, um, marginalizing of people struggling with poverty, with substance use disorder, with domestic violence, right? These families have strengths that have been untapped for a long time. And when you go in and begin to truly listen, you're going to hear some stuff you may not want to hear. But if you can hold true to why you believe this is important, the outcome is going to be amazing.
I think for me, a message that I would give is like hope is at the heart of our work. When we become involved, on an individual or community level, we hope that our work plays an important part and leads to successful outcomes, and even when things are tough, don't give up. I was personally one of those tough, cases. It wasn't my first, round of being involved in child welfare when I got it. And a lot of the times, you know, our work, it gets tough, it gets hard, but don't give up and just continue to have hope, because where there's hope, there's definitely work and inspiration behind it.
Thank you so much for sharing those thoughts and for talking with us today. It's really amazing all that you've accomplished over the last 2.5 years and continue to do and did before, and all the work you're doing to push against the way our systems are not currently set up for. There's really not a template for it, and for the kind of world that supports well-being truly and centers community. And so what you're doing is really cutting edge. And thank you for sharing your learnings with the folks who are viewing this video. Much of what has been shared today is also embedded in the principles of the Community Bill of Rights, which highlights the rights community members have with working with systems, which can be a great starting point on a journey towards centering community. We'll include links to both the Community Bill of Rights and more about PCSAO's framework in the description. Thank you again, Angie and Mike, for talking with us today.
Thanks for having us.
Thank you.